All right. Well, hello, everybody, and welcome to this week's episode of Perspective Matters, this week in behavioral healthcare. My name is Glenn Hadley. I'm your host today, and from Southworth Associates. We're sure glad that you joined us. Thank y'all for being here on this Christmas week. I think it's pretty awesome that we get to share the holidays with everybody, and whether you're celebrating Christmas or Hanukkah or Kwanzaa, we're just definitely glad that you guys are here and joining us today. Let's see. So I'm currently here and hanging out with family in Austin, Texas. Really glad to be down here and seeing everybody. I hope that you guys are watching with your friends and family and are taking some much needed time off and getting to enjoy this little break. But I do want to take this opportunity before we kind of dig into this to just wish you a really happy holiday season. Don't forget to reach out to those that are less fortunate and invite them to the holidays with us and to be a part of this deal. So just wanted to do that. Also, before we get started, just want to let you guys know, if you're new to the show, that here on Perspective Matters, we address topics in behavioral health care that range from clinical, operational, marketing, business development, and public policy. And our goal is to be a resource to our field and a platform to bring mentors to those out there on the front lines that are doing the work. All right. So I would like to take a moment and thank our wonderful sponsors, Southworth Associates and Dreamscape Marketing. Without these two wonderful companies, this show isn't possible. If you guys are looking for information or need anything in the intervention side of behavioral health care, or on the compliance monitoring side, or even consulting, Southworth Associates should be your first call. Reach out to those guys there. They'd love to talk to you about anything as it relates to behavioral health care. Also, we've created a virtual events platform, which is fantastic. If you're looking for a virtual event solution for this new normal, definitely reach out to us at Southworth Associates. We'd love to talk to you about that. Also, if you're looking for any marketing needs in the field of behavioral health care, the experts in this are Dreamscape Marketing. So talk to the guys about that up there in Baltimore. They'd love to help you, and they are definitely leading the field in that. So reach out to them and thank them for letting us be a part of the show. All right, so I do want to take just a quick moment, and we're coming up at the end of the month, but don't forget about Perspectives, a time for change. This is our virtual conference that we just did. We are giving that away for free this month. This is kind of our holiday present to you guys, but we're giving away 35 plus CEUs for free. And so if any of your team needs to go ahead and get those last CEUs to satisfy their licensure before 2020 is up, you can go do that for free. I don't know any other place where you're going to get that many CEUs for free and see some amazing content. Some of the speakers that came on that show were just unbelievable. I'm still going back and learning stuff from that. So definitely go check that out. You can see that at perspectives.atimeforchange.com and register for free. We'd love to share that information with you, and we're excited about continuing that. Look for Perspectives in Recovery around end of April next year. So even though we're in this kind of interesting space where everything is moved to virtual, we're still trying to bring amazing content to you guys out there, and we look forward to that. All right, cool. So let's go ahead and move into the show today. I want to introduce our guest today is Dr. Lesley Tate-Gould from Lido Wellness Center. I'm really excited to have her on the show today, and there's a little bit about her. She is, she holds a doctoral degree and a master's degree in marriage and family therapy, and was recognized as one of the most outstanding doctoral students of her graduating class. Dr. Tate-Gould's early clinical experience focused primarily on systemic orientation, which complemented her work with children ages 3 to 12 and their families. Dr. Tate-Gould's educational and clinical background informed her postgraduate work with adolescents and families in a residential treatment facility in Orange County, California, focusing on substance use and co-occurring mood and anxiety disorders. As Dr. Tate-Gould continued to expand her specializations to include primarily treating substance use disorders and eating disorders, she began exploring somatic experiencing, a trauma resolution approach focusing on the body's capacity for natural and embodied healing from trauma, which we're going to talk about today. Dr. Tate-Gould then became a certified somatic experience practitioner in 2017 with the approach informing all areas of her work and personal endeavors. So with that, I'm really excited to have Dr. Lesley Tate-Gould joining us today. So cool. Thank you for joining us. I really appreciate it.
Thank you so much for having me.
Wonderful. So let's kind of start off the way that we usually start with the show, is I kind of ask everyone, how did you get into this deal? Because we don't just like start off whenever we're young and say, you know what, I think this is what I want to do. I want to go into behavioral health care and help other people. Like it's usually a lot simpler than that. So how did you find your way into this deal?
I love that question because my answer has kind of evolved over these past few years, the more learning and kind of expansion that I've, come into contact with. My old answer, which is still accurate and holds up, is my junior year in high school. I took an advanced placement psychology course, and the instructor, she was just kind of funky and weird, and I just really liked her. Like one thing that still stands out all these years later is she got married on Halloween, and I just thought that was like so cool and funky. And I just loved her teaching approach. And so she brought just a lot of fun and, kind of just great creativity to learning about the brain and learning about, human systems and kind of how we've evolved. So that was kind of what used to inform, my decision to go into undergraduate and then graduate work. Years later, though, I started to discover, especially because, all psychotherapists have to, really do some of their own deep dives. I genuinely believe this work chose me, just, given some of my family system and, just the way in which I would kind of naturally move into being kind of a consultant, even in peer groups. It just was like a natural transition and field that I pursued. And I never looked back. Like I never had any question, even as an undergrad, of what I wanted to do. The only thing that did shift and took me some time to get used to was when I went into my master's program, I really did want to get started on helping others and working in the field directly. So I used to think I was just going to stop at my master's. But, one thing that you and I have talked a little bit about is, how you can also get an influence from different mentors. And one of my doctoral instructors, Dr. Daryl Friedman, he really inspired me to go that extra mile and to stick with the doctorate, especially as he said, if you want to be a practitioner in, Orange County, California, it's the way to go, because it is such a saturated field here in industry. And so I'm looking for opportunities to kind of set myself apart. So that's kind of where I began.
Absolutely. And every time I speak to somebody that is really doing the work out there, it's amazing how they talk about the education that really needs to take place in this, that we get into this deal with a lot of passion and a lot of fire, but there's also a lot of work that takes place in order to be successful. And so I appreciate you sharing that. And I know, like we talked about getting into the field. What about Lido Wellness Center? Like, how did you get into that? And I like touching on both because you have the clinical side of this, but also opening up a business, which is extremely important. So how did you get into that idea?
Yeah, that's a great question, and one that I really I feel so warm to answer because I'm the executive director, but I'm also a co-founder with a group of exceptional people, and a group of us as leaders, we had formerly worked in a different environment together. We were working in primary substance treatment, also co-occurring eating disorders in a residential setting locally, and we just really clicked. Even though a lot of us kind of, as a clinician, I didn't at times come into direct contact with some of our other leader members, but our influence and connection was definitely there. And so back in 2017, I had recently moved and relocated my small growing family. My young son at the time was only about 9 months old. And we moved to San Diego in pursuit of another clinical opportunity. And I got a phone call one day, and there was just, at that time, it was really just an idea, how can we make an offering to our local community that is something outside of traditional substance treatment? Because as you see, right, in coastal, communities, substance treatment, it is kind of this getaway spot, right? It's beautiful. We're right on the coast. So, there are understandably a lot of treatment facilities, because that is something very valuable and important when people are getting well and sober. But we noticed here in Newport Beach, there wasn't really anything for primary mental health. And so once people, even, when I worked in residential, once people got 30, 60, 90 days of sobriety, if there were other things going on, like a major depressive episode or really, really chronic generalized anxiety, or even maybe bordering into some OCD, there were some limitations, right? There were limitations even for me as a practitioner, what I even understood about, some of that underpinning, even though my formal education was in like kind of broad stroke clinical psychology and marriage and family therapy. So we teamed together, and there's a lot of different strengths and amazing capacities in this leadership team. And so we are clinically owned. So myself and another practitioner, we are part of that ownership team, so that it also can really inform all of our decision-making within the business. Because we are clinicians first and business owners second. And so we really take a firm stance in making sure that that is in every step of the way, really informing our practice and care of patients.
Yeah, and what a need too. I mean, how many times do we see people, our patients come in, they go into substance use treatment and get physically sober, and then all of these other issues start popping up that need to be dealt with. Otherwise, they'll just be right back. And so I've seen it, and oftentimes too, we get somebody into substance use treatment, and a few days later, we're like, whoa, there's really some other things here that really do need to get addressed first, right? And
Absolutely.
so definitely seeing that need is phenomenal. Before we dig into the trauma piece and somatic experiencing, I do want to. I always like to ask about mentors. And you already mentioned a little bit, but like, who are some of the people that maybe took you under their wing on the business side of it, whenever you were like starting to expand the Lido wellness idea?
I would definitely have to defer to Dana Wappler and Kevin Cullen, and even kind of Colin Whedon to another degree. And so these are, other members of our ownership and leadership team, because with their kind of broad awareness and like big picture thinking, they've really been able to take, this small, very intimate program that we first conceptualized back in 2018. At that time, Frances Milligan and I, so she's our program director and also a clinician, of course, we set our sights on having 8 patients. Like that was it. Let's do really small, very, kind of intimate, very concierge type of care with a big emphasis on groups and community building. And our other leaders, once we kind of got going and we, stumbled a lot in our first year, of course, they just knew that we had something really special and unique. And so I looked to them and put all of my faith and trust in the growing of this business, into some of their guidance and direction, because that is definitely an area that I'm not as familiar with. And truth be told, I can get a little fear-based, right, when I'm looking into expanding in that type of realm. So I've really, trusted them in a lot of ways. When I was also just reflecting on this question, I was also thinking of some of the mentors and even just some of the authors that I really appreciate. And they're ones that are willing to be direct, to be bold, to ask questions, to, do some things different. And so I don't even know if she's still alive, but a professor that I actually got to assist in 2 years of my undergraduate work was Dr. Patricia Tackett. And she was incredible. And I got to, work with her and, do different like sex education courses and sex therapy courses for underprivileged adolescents in the area. At the time we were like in Escondido, because I'm an alum from San Diego State. And there was such a boldness and fierceness. I mean, a good example is during our commencement ceremony, she didn't want to sit with the other faculty away from the students. She sat with us in the row, because she felt like the most impact you can have is with like a deep relationship and connection with forward leaders and with people who are going to be paving the way once she retired. So I think like that type of energy I'm always inspired by. And in fact, a lot of the thinkers and, readings that I follow, I mean, they're people that are, paving new ways. I mean, Peter Levine, the founder of SE, Somatic Experiencing, I mean, this was completely different as a modality and a framework of understanding trauma, that really, I think, in a really positive way, is taking more traditional psychotherapy approaches and really challenging them to be more integrative with the nervous system. So, there's a lot of directions I can go with that, but that's kind of a taste of, some of the people that really inspire and continue to invite me to really challenge myself clinically.
I love that. Thank you for sharing that. And I found pretty often that the mentors out there, the people that are leading the way, are so open and want people to collaborate with them and want to hear from people. So it's great to hear that. You mentioned somatic experiencing and trauma work, and I do want to clear something up, because one of the things around trauma that I see on our side of here in behavioral healthcare is that people throw out the word for just about everything. And they're constantly saying trauma, we need to be trauma informed, we need to treat trauma, we need to do it. It seems like everything is trauma these days. And I have my own thoughts about why, but let's go ahead and clear up for the audience, like, what is trauma exactly and what isn't it, right?
Mm-hmm. Yeah. Yeah, such an excellent timed question, especially what's going on in the world around us. So I really lean from, and I share this very openly with patients when I'm doing talks on trauma, or if I'm actually doing somatic experiencing work with individuals. I pull from how Peter Levine defines trauma, which is an interruption or at times an inability to complete a natural survival mechanism. And so by survival mechanism, that goes into three categories. So that's our fight response, our flight response, so that ability to safely flee, and then our freeze response. And so at times when you see kind of an inability, and when I say by completion, what I mean by that is at times, like especially if we're dealing with freeze, like there is a period of time in which the nervous system is actually in immobility, right? It needs to freeze in order to preserve safety. And this certainly happens in more like kind of chronic exposures to things like sexual violence or assault, or where there is kind of a perpetration from a much more powerful figure. That the nervous system is so intuitive that it knows, okay, my chances of surviving this are greater if I become immobilized for a short period of time. But in the animal kingdom, right, so our less evolved, but kind of counterparts, after they go through an immobility, they are able to shake off all of that intense shock and intense kind of dysregulation, and then they just go about their day. But when you're looking at things that might be more chronic, there might not be that safe ability to kind of shake off some of that intense energy. And I kind of equate that to, like, in Levine talks about that as do SEPs. It would be like, you're hitting the gas on your car and you simultaneously have the brake. And so all of that energy needs a place to discharge, to flow out, to move and expand. But if you are in maybe an unsafe environment or a dangerous relationship, it may not be safe to expand that energy, right? And to let it kind of flow out more naturally. So that's where I tend to see kind of maybe these patterns or this stuckness that a lot of people who are responding to unresolved trauma really describe. Like they'll describe things like, gosh, I lost like 2 years of my life and I don't know what really happened. And so it's also not to be confused that people who might be experiencing, especially like a freeze response, that they are somehow completely immobilized and non-functional. A lot of the time, people can be kind of in this chronic state of freeze, but they can be parents, they can be faculty members, they can be CEOs, they're living and operating in their world, but it's at kind of a bit of a distance. Sometimes it's been described to me as they feel as though they're kind of watching somebody's life, but they're not a participant in it. And so some of that vibrancy, that intensity that sometimes life can really present, it gets a bit dimmed, right? It gets kind of numbed out. It's also certainly why at times people will kind of gravitate toward mind and mood altering connections or mind and mood altering behaviors. Because I sometimes see even in my clinic work that people want to feel, right? They want to at times kind of enliven some of what feels so dampened, but then they might go about it in very kind of maladaptive or, unhelpful ways. What I like to distinguish, especially in like partial hospitalization and intensive outpatient, which is like our programming in Lido, is that trauma is not strong feelings. However, if we've been in an environment in which maybe feelings weren't cultivated or even talked about, right? Where maybe as a young child, you'd feel something really strongly and then you were told to go to your room or don't pay attention to that, like get back to work, right? Sometimes our academic settings can kind of promote that too, that kind of maybe stuffing. All of a sudden in like an environment like ours, or maybe even a higher level of care, people are starting to come into contact with feelings, but they can feel so dysregulating, right? I kind of equate it to like when somebody's feeling maybe for the first time in a decade, it feels like they have exposed wires, right? It's almost like too much. And so the pain is real. Like at times the struggle is real when they're coming into contact with those feelings for the first time. But strong feelings in and of themselves may not be indicative of unresolved issues pertaining to trauma. And I also like working from Levine. As you can see, I'm clearly a fan, right? As an SEP, I like working from his conceptualization that trauma is also not contingent upon the event itself. And that's really important because it allows us to also hold some hopefulness and humanity that even if somebody has gone through something really tragic or really maybe on a global level catastrophic, like what comes to mind is like the 9/11 attacks.
Mm-hmm.
Some individuals absolutely experienced unresolved fight, flight, or freeze response. Absolutely, they were in great danger. However, that doesn't mean that everyone who went through that process is traumatized, right? So that's a really key distinction, because if not, then we could be blanketly prescribing something to someone where they may not actually, relate to that, or they may not connect with that type of language. So I'm also very careful to, if I'm working with someone and if they're not using the language like trauma or this was very traumatizing or this was very tragic, I'm not inserting that for them. I am a careful observer to ensure that perhaps what they have experienced, they would describe as really dysregulated or really a terrible time in their life. So I'm going to use and reflect that language. I'm not going to just kind of insert my opinion of what may be or may not be trauma.
So let me ask you this: how come in your opinion, how come we use that word so much? And we do associate it with strong feelings or strong emotions. Why is it used so often? And I mean, is it in a way to be able to just put a word to something that may take a lot longer to unpack or to dig into? Or is it just kind of like, okay, we're calling it trauma and it's over there, and now we can move over here?
I think the first example, what strikes me is that when something is as complex as human emotion, right? And we're also kind of in an infrastructure here in the United States and in other developed countries, of course, I'm not going to just like kind of be singular to us, in which feelings sometimes are not a landscape that is given a lot of permission to explore. I recently read and really recommended this book to a lot of my patients, which is Mark Brackett's Permission to Feel. And throughout that book, he really talks quite honestly about what the world could be like if we actually spent more time saying, how are you feeling? And actually being prepared to allow people the space to give a genuine and authentic response. But so often, right, we get the question, how are you feeling? Good, great, everything's fine. And then we move on. So I think the use of trauma, it can take something that is so complex and has such a different comfortability like emotion, and it objectifies it. It simplifies it down into something that feels more manageable. It feels more in our kind of authority of control. And so it gives us something that we can kind of grab onto and say, okay, this is what this is, because I don't know what's happening in my nervous system and I don't know what's happening in my feelings, but I do know, and I've read some books and I can, really kind of hold on to this being something that I can heal from. So in that way too, I think it's really helpful. We do that in a lot of ways. We kind of bring something that's very complicated down to something more simplified.
Yeah, and so that's not surprising, because we see that in psychotherapy often, how we can get wrapped up in the modality or the process so much, right? And forget the bigger picture, because we can actually put our finger on the process. We can actually say, this is, oh, look, 1, 2, 3, this is very simple. And it gives us the illusion of control over it. So I can see where that would make a lot of sense. I appreciate your thoughts on that. Let's talk a little bit about uncovering trauma. And so like, how do you go through a process where you uncover the trauma with your patients and then walk with them as they unpack it? What techniques are successful, and what have you found in developing that relationship with the patient that's been very successful for you?
Hmm. So a lot of times, at least in my work at Lido and even in other treatment experiences, a lot of it is really kind of attuning toward what language, like I was mentioning, patients are already using. So if a patient is coming in and saying, these are the events, or this is the trauma that I really want to work with and on, I'm going to follow some of that language. But I usually will also caution, right? I will also sometimes share a disclaimer of like, let's really see kind of what we uncover to also determine like what other feelings might be there, what other sensations might be kind of residing within your nervous system that we may be able to kind of tap into and enliven. So in part of that, to use your word, uncovering process, somatic experiencing, it's a slow approach. There's a lot of attentiveness toward really building a very strong relationship with a person. And so for instance, like when I'm meeting someone, and sometimes at Lido, like I'll be assigned even a case in which I'm only doing like somatic experiencing work. Like I'm not seeing their work all through, from beginning to end. I'm not one of their primary lead clinicians. I, in a lot of ways, won't start off a session by saying, hey, tell me about, what you would term trauma, right? No, we're having conversation. We're just getting to know one another. And I'm really in some ways, it's very strategic in trying to enliven what are some of those other aspects or those other parts of this person that have maybe been really hard to reach or hard to kind of access when they have felt maybe so kind of disconnected or ambivalent about even wanting to be in their life. So we'll talk sports, we'll talk, what are their hobbies, what are their interests, what makes them laugh, and so a lot of times, and I even learned this kind of, it was like termed actually a technique in SE, we use chit chat. We're just chit chatting, we're talking. And so a lot of times I'll also share with people that they may also be expecting or anticipating doing more of like a quick deep dive into some of the more like discussion about maybe the event itself. And so I'll say, hey, we're still working on things, because the good news is that no matter what we're talking about, your nervous system is with us. Right. And so sometimes even through like those, kind of efforts of just getting to know a person and really, as we call in clinical terms, building rapport, then we'll start to notice, because our training is really designed to really be meticulously also looking at what is happening in the nervous system. What are some of those, what we call really micro behaviors that are really being elicited to inform us as practitioners? Okay, there's maybe like a patterned behavior that this keeps happening for this person. And it can be as subtle as, I'll show you, it can be as subtle as this. Like when they're talking and there's like a little bit of a head, shift. Or they might do kind of a really more generalized behavior where they might be doing kind of a supportive stroking or a holding posture. And so a lot of times in SE, it's like, and in trauma work, how do we slow some things down? Because when people have experienced kind of that unresolved of healing, things are sped up, right? They want to heal. They want, to have resolution. They want to get back into their lives. But we really carefully pace things, because what we also know is we need to ensure that as a team, right, as I'm working with someone, we're building this container to notice discomfort. And a lot of times, believe it or not, discomfort resides in the body as emotion. Right? So I'll like lock in on, after I've worked with somebody for maybe a few sessions, if they're bringing in fear or guilt or shame is a biggie, right? Shame is not something we like as a human species to get near, because it is so painful. I'll just hold in on that. Let's notice that. Where do you notice the shame? How do you know that it's there? What does it feel like in your body? And so even though we are most certainly working with maybe some of the undercurrent of what's happened maybe within that event itself, we're not talking up here with the content. Because what also happens in trauma, especially if people have legitimately needed to be in a freeze response, they're not inputting memories at that time. And for good reason, right? If you're faced with something that's terrifying, you don't want to be fully taking in all of that, detail that might be very, very internally upsetting and dysregulating. And so we don't want to rely on memories as SEs, because sometimes we might remember something that maybe didn't happen, right? Like that can certainly happen too, right? For any of us as human beings, right? When we've had maybe an upsetting conversation, like with a peer or a parent, we can certainly retell it in a very different way than maybe if somebody was watching that interaction happen. So that is really, it's just part of how we operate and navigate through something as a human species, right? We can definitely get swept up in when there's a feeling. Another technique that I absolutely use in almost all of my sessions is a process of orientation. So it's really allowing someone to not only kind of be in noticing of, we use a lot of tracking, use a lot of just gentle noticing of different sensations. So we do a lot of orientation of what's happening within the nervous system, but also to be supportive, an orientation of what's happening around them, right? How do they even notice their body within this space that might be my office, or might be this walk that we're, finding ourselves on? And for those that have been more kind of chronically exposed to maybe very chaotic or dangerous, people or environments or events, I'm going to be very slowly paced with how quickly I'm going to be going internally into the nervous system. Because, our internal landscape, for those that have been violated, it can feel like dangerous ground. It can feel like, gosh, I can't go there. I'll be too dysregulated. I'll be too susceptible to harm. And so with that type of nervous system and, processing, we look outward. We bring in natural elements. I have plants in my room. I have books. I have colors. I have things that people can really allow their eyes to go to while we're doing some of these deeper dives into some of the more, what we would call like trauma-oriented work.
So let me ask you before we go further, for some of my audience out there that maybe is not as familiar with somatic experiencing, can you kind of give a definition for them? So, because we've been talking about bits and pieces of it, can you define that for them?
Gosh, I'm going to try to do this the best that I can, because I think, you ask any 5 SEs, they're all going to give you a different response. Right. However, how I come to understand it in my practice and using it as a regular modality is it is a trauma-informed approach that integrates and invites in the body as a vehicle for healing. And so it is very different in kind of comparison to even my, kind of historical and formalized training. I was a traditionally trained cognitive behavioral therapist. I wrote my dissertation on CBT. And so for me, that was all head work, right? Like, how are we going to challenge our emotions? How are we going to challenge our thoughts to then incorporate more healthful or more regulated behaviors? In my original CBT work, I never really did a lot of deep diving into body, with the exception of maybe doing like some breathing exercises, right? Because those have, of course, been, known to be tremendously helpful, especially in the management of anxiety. But when we were doing emotions, we were just kind of talking about emotions as kind of this intangible idea, right? It would be accompanied like often with a thought. Whereas in somatic work, you are bringing the nervous system into all aspects of the work. And so it might even be, if I'm noticing maybe somebody sitting across from me is starting to really get more activated or get more into a space that is, maybe dysregulated, I'll do something like, hey, let's put a hand over our heart and hand over our abdomen. And it's not to make the feeling disappear. It's to give it a robust grounding so that we can actually keep going, and that person can be reminded, wow, like, I actually have with my own hands the ability to regulate my nervous system. I don't need a phone call to someone in this very moment. I don't need a drug or a drink. I don't need to go watch something on Netflix, right? Like, I can actually, with my own supportive features, regulate my system. And so we're really, SE just incorporates, and obviously that's kind of like an intro and, the broad strokes. But as, people, get more advanced into some of their processing work, you're really bringing in more elements to also reignite those, the three Fs, fight, flight, and freeze, to really ignite those again, right? We want that feature, that safety feature to come back online. And so we want to invigorate that at times in trauma work, but we obviously don't want to invigorate it by putting somebody back into harm's way, right? And so that is kind of a pattern that can happen when people have experience ordeals or events, unconsciously, their nervous systems are seeking out tremendous healing. But we might seek out some of that completion of, say, a fight response, right? We might seek out the completion of maybe having vengeance on someone who has really harmed us. We might seek it out by continuing to put ourselves unintentionally into another environment, or in a lot of us, another relationship that has the potential to keep harming us, not helping us. So in trauma terms, we call that reenactment.
So when you're walking with a patient through this, you're asking them to explore the feeling, but then also to at the same time, like, introduce a physical factor, a touch, or to bring more of the outside into it as well. And so that a lot of times I can imagine that would be pretty uncomfortable in the beginning, and so in this process, do you find that the establishment of a real therapeutic alliance, even like you mentioned earlier, the attunement, it's so important to that, so the client or the patient will trust what you're saying to get to that point? That's kind of what I'm hearing, right?
Absolutely. So a tremendous amount of attunement, and also really careful pacing. And so really kind of depending on, one, what diagnostically am I working on with a person? For instance, like in my experience in specialization of eating disorders, I'm not maybe for the first 20 sessions going to be kind of inviting a patient to get more familiar and comfortable with their body. Because with disordered eating, there's such a fracture in that relationship to their body, and there's so much displeasure, and at times it can feel just downright unsafe to be near their system. Whereas, like, I might use a more thinking channel, right? I might use in that way a more traditional approach like cognition. But then I might, over time, of course, and through that really careful alliance and attunement, I'm going to see, okay, can we start getting near this? But I might get near it through, okay, so you mentioned like feeling really afraid of this, right? So how do you know it's fear? Like, where do you notice the fear? And a lot of times, right? Because as our human nervous systems have evolved, right? Fear often for a lot of us resides here, right? And so sometimes in just using their language also, and really mirroring and modeling what words they're using, we can get near that system with, again, careful pacing. Say, oh, well, I feel I feel tightness. I feel a lot of tension here, and I'm really feeling afraid. Okay, can we be with that for a moment in time? And I'll use the phrase even, can we dip a toe into that? Can we just kind of be with that for a moment? I assure you that I'm not going to let you, kind of become dysregulated. For those that I've worked with who have had panic episodes, I'm not going to sit back and allow you to go to a panic episode. We're going to be working with this, and it's going to be, one step at a time, very, very gradual.
Right on. Thank you for sharing that. I do think that's one of the most important things as we walk through this. I want to shift just a little bit from, we've been talking a lot about the patient or the client, and I want to talk a little bit about the provider for a second, and how important it is for providers to do their own work in this. I'm really excited as hosting a number of conferences over the last few years, and I'm seeing more and more speakers talk about the importance of doing your own work in the field. And so let's talk a little bit about that. Like, because I know you, as the leader of a team at Lido, you have a number of professionals that work under you. How do you keep that focus for your professionals to do their own work, and how do you support them in that?
Great question. Our own work as professional helpers is essential, because we're human too, right? As providers, it doesn't mean that somehow we've, kind of moved through the world unscathed by any type of, difficult feeling, challenge, or potentially our own unresolved issues around trauma. So our own work is so essential. And, what comes to mind is, one of our core values amongst our team here at Lido is transparency. So sometimes it's even just being able to, as a leader, be able to have dialogue about, I really found this particularly, helpful in my own session work, or this is what I was really working on. And of course, sparing people the, grim details, right? Because that's not as important, but really just kind of being a model for, I've been on the other side of the chair, and it's essential. In the last 2 years have really incorporated a very regulated and set mostly daily. Sometimes on the weekends it gets a little, lenient, but daily meditation practice. And so I'm very open, right, and forthcoming with how much of an impact that has had on my life. So a lot of transparency, a lot of dialogue amongst our team. We also, as a team, really value staying on top of really cutting edge modalities and educational components of our care, because this is a naturally evolving field. So we schedule in our what's called like weekly treatment team, where we meet as an entire team of clinicians, and at times our medical providers are also able to join us. We set aside about 30 to 45 minutes at the top of that team meeting to have an integration of some form of training. So we did as a clinic an entire 2-day intensive over the span of several months, because, breaking it into these chunks, on internal family systems therapy. We're looking at, different modalities. Right now we're in the midst of a training on neurofeedback, right? And just understanding how we could maybe invite that into our clinic work, and just kind of build a better, robust understanding of how we know how it helps patients in our clinical work. And we also, finally, we offer an annual stipend to all of our clinicians so that they get, access. And, obviously as clinicians, when we're licensed, we're required and mandated to, have a certain number of continuing education units completed every 2 years. However, I think this stipend is a real offering, because then it allows people a bit more flexibility to not just feel like, okay, I've just got to check this box and, get these 36 hours done. It gives them a little bit more flexibility. Like, hey, I've really wanted to learn about this, and now I've got some resources to do it. And so why not, so those are definitely, areas. And then I'd say a lot of consultation. We are not perfect. And again, we are humans in this environment. And so we take a very open door policy that we work as a team. And so when we're working in patient care, we need and rely upon that team to check in with, to sometimes, kind of cut loose with, and just say, whoa, like, this day has been way off. Like, and I'm, noticing all of this. Like, what do you do when you notice that? Right. So it really also fosters just such an environment of camaraderie. And also that we're sharing that vision, but also not feeling like we have to, solely be kind of the holder of all the information and the knower of all things, right? Because we couldn't possibly, we're all complex humans. And so what we are bringing to the table could differ even on a day of the week, right? Where we might be confronting some of our own challenges.
Absolutely. I just think that's extremely important, because how often do we see people in our field, that, especially working in direct care, that really need to do their own work and really need to progress through some stuff, but they feel like they can't, and they feel like they're the ones that are supposed to be providing the care, and then they end up working on their patients, and it's just, yeah, I see that quite often, and so I really applaud you for doing that, and providing that for your staff. What's been the response from your staff? Let me just ask that, from the work that you've done in creating that environment where there isn't fear, where you can share and be authentic. What's been the response from your staff?
I mean, that's kind of one of the favorite parts of being a leader on this team, is getting to hear, to some degree, and for a lot of people, a reparative experience. That we really do, like, we walk our walk and talk our talk as leaders and clinicians. And so a lot of the feedback is really genuinely like just gratitude, gratitude that they have a space in which they can work. They can also expand their resources, and even, kind of lean into some areas of training and expertise that they're maybe less competent in, but that as leaders, we also want people to grow. For instance, like, we are a very group-oriented kind of service, provider. So we run a lot of groups throughout the week. Our partial patients are in, up to 4 to 5 groups on any given day. And as leaders, we trust that the clinicians that we've taken on and entrusted in our patient care, that we really value, that they're going to bring their best selves when they're feeling taken care of. And so we also invite them to create your own curriculums, create your own areas of interest and where you want to dive into and what you want to learn more of. And I think it really speaks to the patients also feeling that energy.
Yes.
Because when practitioners are coming in and they're feeling excited and passionate about the work and that they have some freedom and autonomy in their work, it's such a beautiful co-regulation, right? The patients feel more supported, they feel more seen, and then they get to do some really creative out of the box things that maybe they've not been able to do anywhere else.
Yeah, that's amazing. I really appreciate that. Is seeing that around the field, that the environments like that really do create some of the best care for our patients. So kudos to you guys there. I like to ask this too. We're wrapping up here. We've got a couple more questions, but if there's somebody that's interested in getting into the field of behavioral health care, whether it's on the clinical side or the operational side, like you have your feet in both sides of that, what advice would you give them? Like what are some of the things that you would say really take care of these?
Yeah. I mean, the first that immediately comes to my mind is read, and not just, clickbait and on the social media platforms. Pick up books. I mean, truly, like, immerse yourself in modalities and, experts that you may not, like, kind of upon first glance really connect to. It's really why, like, I never knew. It wasn't until I was already a licensed clinician that I was even introduced to this idea and awareness of the modality of somatic experiencing. And I went into it really not knowing what I was getting myself into. And so also kind of with that reading and like seeking out mentors and authors and experts that have kind of maybe differing opinions, flexibility. Going in knowing that you may envision going one direction in your career and it may take you in a completely and more meaningful and nurturing direction. And so not getting hung up on, well, I have to specialize in this because this is what I want to do. When I set out to be an early career therapist and psychologist, all of my pre and postdoctoral work was all working with children. As you mentioned in your introduction of me, I never could have anticipated or imagined myself working in a residential setting for substance use. And most certainly I could have never imagined owning my own clinic with a great, team of experts and leading the charge on, primary mental health service. I thought I was working with kids. I was set on becoming a play therapist. I loved that work. It was so enriching. And then when I was, kind of facing licensure, it was really hard for me to find work. At the time, I was living up in San Jose. That's where I did my postdoctoral work with Kaiser Permanente. And a great friend of mine from school, she said, hey, there's a residential substance abuse clinic up in Orange, not far from where I live. They're looking for a full-time therapist. Are you interested? And at that point, it was like truly scarcity. I was like, yes, I'm interested because I need to work. I didn't know the language of recovery. I didn't know the language of substance addiction per se. I mean, I, of course, done my coursework and that kind of thing, but I had never lived, within, that day to day. And I'll never forget one of the first groups I observed on my very first day. I was spotted from a mile away of my greenness. Those teenagers, boy, are they so intuitive. And one of them looked at me and she said, you don't even know anything about this. You're just a normie. And I could have, tail tucked and said, oh my gosh, I'm never going back. But instead, I wanted to know more. And so I was humble enough to say, you know what? I don't know a thing about this. And so I need to inform myself. I need to be talking with people. I need to be reading and getting myself educated. And so that's what I did. So it's, I guess in that way, it is advice as far as just staying flexible and open, so you never know where you're going to end up.
My goodness. I mean, that is so true in our field. You never know. Like, how often do you see someone that starts and finishes in the same spot? It just doesn't really happen. Look, I really appreciate your time today. I wanted to see, is there anything you'd like to leave our audience with before we go ahead and close the show?
I mean, I guess that my final thoughts, especially in a year of all years, is, this is a time, it can sometimes be so uncomfortable for us as a human species to take pause and to take moments of really genuinely checking in with ourselves. But I think this is a time in which perhaps there can be a lot of emotional housekeeping to be done. And so I think it's being courageous in that, and also knowing that as a mental health practitioner, you also don't have to forge that alone. Right? Like, you can seek out resources. There are treatment communities. There are great and exceptional therapists and potentially right, down the street from you. There's a lot of support out there. And if there's anything that I'm so humbled, but also inspired by in kind of witnessing some of this year, it's that mental health is finally getting its name in the stars, right? It's getting, more normalized. It's allowing people to see that it actually takes a lot of courage and bravery to come into a room with someone and unpack something that they've never told another soul in their life. So I guess my final thought is just know that help is there. Lido's here, we're located in Newport Beach. We are here to serve and help. And other than that, I just wish that, people have a really lovely and albeit different, holiday season. I hope they're safe and taking good care and really just taking some time to pause.
Right on. Well, thank you so much. I really appreciate that. And if you guys are out there and you're ever in the Newport Beach area coming up, hopefully, towards the summer of next year, like definitely stop by, say hello, reach out to them there. What I'm going to do is I'm going to put this up on the screen if you would like to get in touch with Dr. Tate-Gould or anybody at Lido. Let's see here. Let me do this. See if I can't get this phone. There we go. There you can reach out directly there, shoot an email or make a phone call and just say hello. Really, the whole purpose behind our show here is to connect people. Like that's what we're real passionate about at Perspective Matters, is bringing people together in this community, in this field, and introducing everyone to services that are out there. I know that whenever I was coming into the field of behavioral health care, I had absolutely no idea that this whole world existed. And there are so many people out there that are willing to help. So please reach out, say hello, collaborate. And that's something I think we can definitely do with this. And I really appreciate your time with this. I do want to mention to everybody once again before we close that don't forget, if you need CEUs and want to see some amazing thought leaders in this field, go to perspectives.timeforchange.com and register for the free event. We're giving it away for the month of December to all you guys out there that still need to get the certification process done, or we just really want to see some of these amazing talks. So go check that out. And then with that, I want to thank our sponsors once again, Southworth Associates and Dreamscape Marketing. If you'd like to reach out to either one of them or just contact me about the show, I put my email down there. It's glenn@southworthassociates.net. I'd love to chat with you guys about the show, about connecting people in this field and getting others on the show. We'd love to talk about that too. So with that, I want to go ahead and wish everybody just a tremendous holiday. I hope that you guys are having a blast out there, enjoying friends and family and doing that, and just have a safe and happy holiday. And we will see you guys next week, same time, same place. And with that, just remember, it's a matter of perspective. Thank you so much.